Imagine walking into a hospital where patients are screaming, alarms are blaring, and stretchers are everywhere. And you have less than 30 seconds to decide who lives and who waits. I'm Sarah, a nurse in the emergency room, and this is what triage chaos really looks like. By the end of this video, you'll understand exactly why some patients get treated before others, and I promise you, it's not what you think. Stay with me, because this is going to change the way you see hospitals forever. So what is triage really? It isn't about who screams the loudest or who arrives first. It's a rapid, systematic process of prioritizing patients based on the severity of their condition, focusing on who has the most life-threatening injuries or illnesses. As a nurse on the front lines, I make these split-second decisions every single shift using a framework we call the ABCs: airway, breathing, and circulation. These aren't just letters from the alphabet. In the emergency room, they represent the absolute difference between life and death. Let me break it down. Airway always comes first. If a person cannot get air into their lungs, nothing else we do for them will matter. A blocked airway is the most immediate threat to life. Once we've established a clear airway, we move to breathing. Is the person breathing effectively? Is their breathing too fast, too slow, or too shallow? We need to ensure their lungs are functioning properly to oxygenate their blood. Finally, we assess circulation. This involves checking for a pulse, controlling any severe bleeding, and assessing their blood pressure. A patient could be bleeding out internally or be in shock, and these are critical circulation issues that need immediate attention. This ABC framework is the backbone of every single decision we make under immense pressure. It's a mental checklist I run through in seconds for every single patient that comes through those doors. Now, here's the part where most people get confused, and honestly, where a lot of frustration in the waiting room comes from. Patients are not treated in the order they arrive. They are treated based on a color-coded system of urgency. This is the core of triage. Let's talk about the colors. Red means immediate. These are patients with life-threatening injuries or conditions. Think major trauma from a car crash, a heart attack, a severe allergic reaction where their throat is closing up, or a stroke. They need intervention right now, or they could die. These patients bypass the waiting room and go straight back. Next is yellow, which means delayed. These are patients with serious conditions that require medical attention soon, but they can wait a short time without it being life-threatening. This could be a bone fracture, a deep cut that needs stitches but isn't bleeding uncontrollably, or a high fever in an adult. They are stable for the moment but need to be seen. Then we have green. These are the minor cases, what we sometimes call the walking wounded. These are patients with minor injuries or illnesses that are not life-threatening. Think sprained ankles, a small cut, or a cold. While they are uncomfortable and need care, their condition is not urgent, and they can safely wait longer than red or yellow patients. Finally, there's black, which stands for expectant. This is the hardest part of our job. These are patients who have catastrophic injuries and are sadly unlikely to survive even with all the resources we have. In a mass casualty situation, the heartbreaking decision might be made to focus resources on those who have a better chance of survival. It's a brutal reality of disaster medicine. So, have you ever been in an waiting room and wondered why someone who just walked in got taken back before you, even though you've been waiting for an hour? This color-coded system is exactly why. It's not personal, it's not random, it's a strategic, life-saving protocol. Every single decision is backed by my training, our hospital's protocols, and a real-time assessment of vital signs like heart rate, oxygen levels, and blood pressure. We are constantly re-evaluating patients in the waiting room because a yellow patient can quickly become a red patient. It's a dynamic process. Let me walk you through what a truly chaotic shift can look like. Just yesterday, we had a 3-car pileup on the highway. A 2-year-old child brought in with a dangerously high fever and seizures, and an elderly man clutching his chest, complaining of severe pain, all arriving within the same 5-minute window. The alarm started blaring, the trauma bay doors flew open, and the controlled chaos began. My heart was pounding, but my training kicked in. You don't panic. You act. The trauma victim from the car crash with visible, severe injuries and unstable vital signs was immediately tagged red. They went straight to the trauma bay where the whole team was waiting. The elderly patient with chest pain? His vitals, his age, and his symptoms screamed potential heart attack. He was also tagged red and rushed back for an immediate EKG and cardiac workup. The child with the high fever and seizures was tagged yellow. While incredibly serious and scary for the parents, the seizure had stopped, and the child's airway was clear for the moment. They needed urgent care but were stable enough to be brought to a pediatric room right after the red patients were stabilized. In those moments, every second matters. These decisions are never easy. Sometimes they feel impossible, but we have to make the call. And here is a truth that most people never see. Our documentation is just as life-saving as our medical interventions. Those triage tags, the wristbands with patient information, the massive whiteboards we use to track every single person in the department, they are the silent heroes that keep the chaos organized. Without this meticulous system of tracking, patients could get overlooked, vital information could be lost, and lives could be put at risk. It's our safety net in the storm. Let's tackle some of the biggest misconceptions about the EA. The number one thing people get wrong is assuming that it's a first-come, first-served system, like waiting in line at a coffee shop. That belief isn't just inaccurate, it would be incredibly dangerous if we actually operated that way. If we took the person with a sprained ankle before the person having a stroke simply because they arrived 2 minutes earlier, the stroke patient could suffer irreversible brain damage or even die. Triage is designed to prioritize the sickest patients first, period. Another misconception is that the waiting room is a reflection of how busy we are. You might see an empty waiting room and think we're just sitting around, but behind those doors, every single bed could be filled with critical red and yellow patients. Conversely, the waiting room could be overflowing with green patients, while the back is relatively calm. The waiting room doesn't tell the whole story. Understanding that triage is about medical urgency, not arrival time, could literally save a life, maybe even your own or a loved one's, the next time you find yourself in the ER. Having that patience and trust in the system allows us to do our jobs effectively and focus on those who need us most. So how do we cope? How do we stay resilient under this constant, relentless pressure? The emotional toll of this job is intense. On any given shift, we are dealing with fear, pain, grief, and the weight of making life or death decisions. It's a heavy burden to carry. But what gets us through is teamwork, unwavering focus, and a deep well of resilience. We are a team in the truest sense of the word. We rely on each other, we communicate constantly, and we have each other's backs when things get tough. We also learn to compartmentalize. It's a survival skill. We have to be able to wall off the intense emotions of one traumatic event to be fully present and effective for the next patient who needs us and the one after that. But that doesn't mean we don't care. It's the opposite. We care so deeply that we have to protect our ability to keep functioning at a high level. And we find small ways to recharge, a quick moment to take a deep breath, chugging some water, a supportive word from a colleague. These micro breaks are essential. Our ability to care for ourselves is directly linked to our ability to care for you. We are human, and this human touch, this camaraderie, is just as critical as any medical skill we possess. So the next time you find yourself in a crowded AN, and you see a nurse moving quickly, maybe without a smile, please remember what's happening behind the scenes. Every decision they make is calculated, precise, and rooted in a deep sense of compassion and duty. What looks like chaos from the outside is actually a highly organized, life-saving strategy in action. Triage isn't about making people wait. It's about saving lives. If this video gave you a new perspective on the realities of nursing and what happens behind those hospital doors, please share it. The more people who understand how an A really works, the more patience and trust we can build between healthcare workers and the public. Respect the nurses, trust the triage system, and remember, they are the calm in the storm. Thanks for watching, and don't forget to subscribe for more insights from the front lines. Stay safe.